Our first speaker is Dr. Julie Varughese, Chief Medical Officer for Americares. She will be sharing a community approach to better mental health. Please welcome Julie.
Good morning. Thank you, Tara, for the introduction, and thank you so much to your friend for having the courage to let you share her story with us today. Today, Tara's friend is doing better with support from friends and family and having access to care. Imagine that you're experiencing depression, anxiety, schizophrenia, and you don't have access to services. The majority of people suffering from mental illness around the world, particularly low and middle income countries, even here in the US, do not have access to the care and treatment that they need to live healthy and productive lives. Growing up, I spent many of my summers in Kerala, India. Both of my parents were born and brought up there, and so we'd go and visit my family members there. And I have so many fond memories of these trips, but these are also my very first memories of poverty and mental illness. Seeing friends and family members, neighbors suffering from depression, anxiety, substance abuse, and even domestic violence. And despite all of the healthcare progress that Kerala has made, mental health has such a powerful social component that cultural barriers like shame, stigma, isolation still limit access to mental health care in India and around the world. I'm so proud that Americares, through the generous support and partnership of so many organizations, many in the room today, as we heard earlier, is working alongside local partners in Kerala to improve mental health access after the catastrophic floods last summer that have impacted more than 5 million people. Americares is starting these conversations on mental health in many other places, working with local partners and local health centers to make sure that we're shaping our mental health programs to be as unique as the communities that they serve. One place we did this is in Nepal, after the most devastating earthquake in decades rocked the country in 2015. A 7.8 magnitude earthquake killed 9,000 people and damaged or destroyed nearly 1 million homes and decimated the healthcare system. In just a moment, lives were changed forever. 100 more aftershocks continued the destruction for weeks, triggering landslides and instilling panic and fear. Imagine the aftermath: unrelenting stress, unimaginable loss, friends and family injured or killed, neighborhoods just completely demolished, jobs lost. Families were living in tents for months, and kids were afraid to go to school. Imagine for just a moment that that was you or your family. As communities started to slowly rebuild the physical infrastructure with support from humanitarian organizations, another emergency revealed itself: a widespread mental health crisis. People young and old were suffering, silently and invisibly. As one survivor told us, people see broken houses, they don't see broken hearts. Americares recognized that gap and began to work with local Nepali organizations to break the stigma and to improve access to mental health care in affected communities. Our approach was simple, and it was locally adapted. In Nepal, street theater is a common form of entertainment, so we decided to put on a play in the middle of town. But our play had a purpose. First, we trained community health workers on common mental health conditions, and then trained performers took over a street and they acted out different scenes on how the earthquake could impact survivors' mental health. Scenes involving depression, heavy drinking, physical violence, and even suicide. People couldn't help but see themselves in the characters. They saw their friends, their family, their neighbors in the play, And the play helped them to discover words to express what they were seeing and feeling. But here is how this project truly made long-term impact. As the play was taking place, the trained community health workers would circulate the crowd, and they'd identify people in need, answer questions, and offer support. The result? Nearly 500,000 people attended the theater events, with thousands referred to and accessing treatment and services for mental health care. And still today in Nepal, the 2,500 healthcare workers that Americares trained, who were all earthquake survivors themselves, remain as community advocates and resources for mental health, laying a foundation to integrate mental health care into the broader health system. The Street Theater Project is really just one example of how Americares is improving access to mental health for people in poverty or disaster. In each case, our approach varies, and we really try to meet the needs of the community, and it really depends on where we're working. Whether it's training midwives in Indonesia or safety net clinic directors in Chicago, we work with local partners to weave mental health services into ongoing and disaster care. Here in the US, we've expanded our partner network to include behavioral health centers that are serving the low-income, uninsured, and underinsured. Also in the US, in the aftermath of Hurricanes Harvey and Maria, we're training 9,000 healthcare workers and first responders on mental health support services so that their communities can be more resilient in the face of the next disaster. In Jordan, we've integrated stress reduction and counseling into already existing diabetes and hypertension programs that are serving Syrian refugees. And in Colombia, Americares is connecting physical health and mental health by offering no-cost healthcare services and counseling for Venezuelans that are fleeing the deprivation at home. No one wants to be ill. We all want to be strong and to be seen as being strong. But sometimes getting help is the best move that you can make. And for Americares, improving that access to mental health services for people that need it is an important part of our mission to save lives and improve health. Thank you.